let this be a normal field trip? With a friend? No way!
Cruising on down Main Street, you're relaxed and feeling good. Next thing that you know, you'll see it. Octopus in the neighborhood, surfing on a sound wave, swinging through the stars. Take a left at Joe and Teston, pick your second.
Good afternoon, class. Good afternoon, Miss Frizzle. Miss Frizzle, what do we need these instruments for? Yeah, are we playing tennis? Well, today is music day. There's nothing like an afternoon filling our ears with the beautiful music and expanding our mind. I knew I should have stayed home today. All right, class, stand up. We're going to get warmed up, or better yet, stress relief. Is it just me? But I'd rather do a recess right now. You too, Betty Sue. Stand up. Hearing with the sound book. Hearing at the speed. According to my research, listening to classical music such as Mozart has a positive effect on brain cognition. It's called the Mozart effect. Very insightful, Dorothy. Thank you. How does the music make you feel?
I feel like I'm able to study more, but your voices are awfully distracting. I'd rather focus without Dorothy's bowing.
Sorry that I know everything. Mother.
Look, Ralphie's even studying.
That's a first. How does music affect my mind? This is awfully confusing. Will listening to certain music make me smarter? We will talk about that today, class, as we delve into the wonders of music therapy. Music therapy? What's that?
Is there actually any real evidence to show that music therapy works?
There's evidence on everything, Keisha. Let's not get ahead of ourselves, girls. We'll figure this out more today in class. Alrighty, kids, do you know what time it is? Field trip time! Not another field trip. Before we take our field trip class, I'm going to give you the history of music therapy. It's been used since the ancient times. It became an official practice during World War I and World War II. And during World War I and World War II, music therapy was used as an intervention in Veterans Administration hospitals for persons with traumatic brain injuries. And you can find the rest in your fact sheet, class. Alrighty, guys, let's line up and go.
On the magic school bus. I think I'm gonna be sick.
No way! Okay, guys, do you know where we are?
Like we're on a secret governmental spy mission or something.
No, Ralphie, we're at a hospital.
Hey guys, we're at the SLU Cancer Center today, and I'm going to introduce you to a special guest, a real music therapist.
Could you introduce yourself, please?
Hello, my name is Crystal Weaver, and I'm the music therapist for the SLU Cancer Center.
What is music therapy?
Music therapy is the use of music to accomplish non-musical goals.
What do music therapists do?
Music therapists use music-based interventions such as lyric writing, lyric analysis, entrainment, and different types of autogenic and progressive relaxation to achieve the goals that the patient has in their care plan at the cancer center or wherever they are.
What do you specifically do as a music therapist?
As a music therapist, I am a full-time employee of the SLU Cancer Center. At the SLU Cancer Center, my responsibility is to provide music therapy services to individuals who are diagnosed with head and neck cancer, leukemia, and lymphoma. I see those individuals in the hospital after they've had surgery while they're receiving chemotherapy treatments during their stem cell transplant, bone marrow transplant, and also during radiation therapy. I'm also required as the program director to develop research studies. We currently have 2 research studies that are being developed here at the SLU Cancer Center. And I'm also required to be head up all the volunteer services. We have the St. Louis Symphony Orchestra members come in and volunteer once a month, and we also have students from the SLU School of Fine and Performing Arts who come in to volunteer. I'm also required to be a supervisor for music therapy internship students who come to the site from Maryville University.
What is the difference between music therapy and musical therapy?
There is a difference between musical therapy and music therapy. First and foremost, only a music therapist can provide music therapy services. Musical therapy can be provided by other services such as physical therapists and occupational therapists. Musical therapy basically involves using music to assist you with the goals and interventions that are set up by occupational therapists and physical therapists. However, music therapy goals are more specific and require more training.
Who can benefit from music therapy?
At the SLU Cancer Center, some of the benefits that we see from music therapy is a decrease in blood pressure, a decrease in pulse, and a decrease in respirations per minute, which we can use as measurements to show that music therapy is helping decrease our patients' anxiety, agitation, and physical pain.
Do you see any improvements in your patients after undergoing music therapy?
Personally, I believe music therapy works because music affects every single part of the brain simultaneously. Therefore, if one person's part of the brain is not functioning adequately, the other parts of the brain can still attend to the music therapy task. For example, Gabby Giffords, who has unfortunately experienced a traumatic brain injury from being shot, she utilized music therapy to help with her speech therapy. She was still able to sing even though she was not able to speak, and so the music therapist worked with her and at her rehabilitation site in Texas to be able to sing what she wanted instead of speaking what she wanted, and with the speech pathologist they slowly transferred that over into her verbal speech.
What is entrainment?
Basically, entrainment is matching the speed of music to a resting heart rate, which is usually anywhere between 60 to 72 beats per minute. We usually set the music at 66 beats per minute, which is a good average. If we can set the tempo to a specific resting heart rate, then the patient's heart rate and respirations will begin to entrain or match the speed of the music. So if an individual is anxious or agitated or experiencing physical pain, usually their blood pressure is higher, their respirations are higher, and their pulse is higher. So one way that we can assist that individual is to slow those things down or decrease those things. And if you have a more regular blood pressure, if your pulse is more regular and your respirations per minute are more regular, that means that the medication that they're giving you for your anxiety or for your pain management will actually take effect more quickly.
What are some misconceptions about music therapy?
There are some misconceptions about music therapy. Some of them is that every client or patient who participates in music therapy has to be able to play an instrument or be able to sing. That is not the case. Music therapy does not require the patient or the client to have any background in music whatsoever to actively or passively participate in music therapy sessions.
Is there research to support music therapy?
There is research to support music therapy. If you want to read about some of the several research studies that are being conducted in the field of music therapy, you can look at 2 journals here in the United States. The first one is Music Therapy Perspectives, and the other one is the Journal of Music Therapy.
What schooling did you go through to become a music therapist?
To become a music therapist, you at least have to have a bachelor's degree in music therapy. You can also get a master's degree in music therapy and a PhD. Currently, there are 71 universities here in the United States that offer a degree in music therapy. The closest one to St. Louis University is Maryville University in Chesterfield, Missouri. You can receive your bachelor's degree in music therapy and your master's degree in music therapy from that university. After a student finishes their bachelor's degree in music therapy, they are then required to do a 1,020-hour internship at a site with a population that they would like to work with in the future. If you did the math, 1,020 hours, if you went to your internship site 8 hours a day for 5 days a week, it would take you 6 months to complete.
What kinds of settings do music therapists work in?
Music therapists work in several different settings. For example, here in St. Louis alone, music therapists work at the SLU Cancer Center for BJC and hospice, in Children's Hospital, and in the psych department. Music therapists also work for a special school district, for traumatic brain injury at Mercy Hospital, and also in psychiatric settings.
How do you incorporate music therapy into your life?
I don't officially incorporate music therapy services into my own life. I don't receive music therapy services from a board-certified music therapist. I do think that music therapy and just listening to music can be a great medium for stress relief, and so I usually listen to a lot of music while I'm in my car and driving to and from work. But other than that, I do not use a lot of music. It's kind of the same as a nurse going home and taking people's blood pressure or temperature on their off hours. So usually I try to stay away from playing instruments when I'm in my personal life. It gives me a good separation between my work and my professional life.
What does a music therapy session look like?
A music therapy session usually lasts anywhere from 30 minutes to an hour. It typically runs about 45 minutes. However, music therapy sessions can be longer or shorter depending on the client or the patient's needs. A typical music therapy section really depends on the population that you're working with. Music therapy can either involve passive involvement or active involvement. If the client is passively involved, you will not see a lot of responses from the client. The client won't be required to interact very frequently with the music therapist. In active involvement, you will see a lot of interaction, whether that means that the client will be playing their own instruments, will be singing, will be writing lyrics to music, or that they'll be working on things such as gait training with the music therapist.
Could you please show us what you do at a music therapy session?
Do one song for you. Usually over the course of a session it takes about 30 to 45 minutes, so it usually does not happen immediately over one song. Basically what I'm going to do is start the music at a very fast tempo or a very fast speed, and over the course of the song slow the tempo down to about 66 beats per minute. Every morning you greet me, small and white, clean and bright. You look happy to meet me. Blossoms of snow may bloom and grow, bloom and grow.
can do it. It's time to take chances and be
Awesome!
So why do we have to do this drum circle?
Keisha, through drum circles, everybody shines.
Oh, please. Ralphie, Miss Frizzle is right. Through doing drum circles, it raises levels of endorphin and oxytocin in the bloodstream. Oxytocin,
which helps lower stress and accelerate learning.
So class, what did you think about what you learned today?
music therapy is fun!
Surfing on a sound wave, swinging through the stars. Take a left at your intestine, take your second right past Mars on the magic scuba. Navigate a nostril, climb on the magic scuba.
1, 2, 3, 4. Oh, 1, 2. Okay, guys, do you know where we are? Hey guys, we're at the SLU Cancer Center today, and I'm introducing.
What is music therapy?
We might want to redo that one.